Hello and welcome to our presentation on the binge eating disorder. So I am Kayla Adams and I have role A. So I will be giving you a quick but concise and to the point overview of this disorder, what you should look for, what it looks like, and especially what it looks like in other people. So let's go ahead and jump right in. So binge eating disorder is characterized by eating large quantities of food in one sitting. And this is usually now done very quickly and to the point of being uncomfortable or painfully full. So you're really just eating and eating until you're in a lot of pain and you're really uncomfortable. This is not to be confused, however, with the holiday or cultural celebration eating that most of us do. So, for example, many of us tend to overeat on holidays like Christmas, Thanksgiving, 4th of July. So we tend to eat lots of food in very short periods of time. This would not be considered part of a binge eating disorder. So if you are indulging on these days, there is no need for you to think, oh, I'm having an issue or I think I have binge eating disorder. This is the most common disorder in the United States, eating disorder in the United States. So when it comes to eating disorders, this falls in the family of anorexia and bulimia, and this one is actually occurring for the most part more often than any of the other binge or other eating disorders. So there are a couple of specifics to consider when you're trying to diagnose this in a patient. And there are things to look for and, kind of look to see if they are occurring to know if, hey, this is a binge eating disorder. So let's go through those. So having a recurring episode of binge eating at least once per week for 3 months. And an episode, just to clear up anything around that, would be characterized by having within a small amount of time, eating large portions of food. And that's, more food than most people would eat within that small amount of time. For example, say within an hour and a half to 2 hours, you get 3 Big Macs, 2 large fries from McDonald's, and, an order of 20 chicken nuggets. And you eat all of that quickly in a very short amount of time, between an hour and a half to 2 hours. That would be a binging episode. So that's something to look to see if is happening at least once per week for 3 months. So something that is continuing to happen often enough and within a 3-month period. The excessive consumption is accompanied by a sense of lack of control. And this just means that once you've started eating, it's very hard and difficult to stop. You just keep eating and you can't control yourself or stop. And if, for example, someone calls you on your cell phone and it's ringing, you probably won't stop to answer it. You'll just continue eating until you're done. That is different if, say, somebody walked in, like if your mom or your roommate or your partner walked in and found you binge eating, you'll quickly try to stop and hide what you're doing. And that actually brings me to my next criteria. And this is people with binge eating disorder are usually pretty ashamed of their eating problem. So people who do binge eat really are very self-conscious about it. So they know that it will be seen a certain way by people in general, but also by people who care about them and who are close to them. So people tend to hide it and be ashamed, and this could be, meaning that they eat alone a lot. So if you have roommates, maybe you eat in your car because that's the only place where you can be alone and not seen while you're binge eating. Or maybe they hide the food wrappers or evidence of the food so nobody knows that they had just, ate a ton of Taco Bell or, a ton of chicken or something like that. And they may lie about their meals. So say someone's like, hey, when did you eat? You're probably going to lie or lie about how much you ate, regardless of what they're asking. So these are definitely some things to look for in terms of, is this person experiencing binge eating? As I said, so there are some other things to consider in terms of a diagnosis, and 3 of these have to be met in order to make it a diagnosis. First of all, let's remember there has to be some marked distress about the situation. So they really have to be dealing with the agonies, the shame, the guilt, maybe the physiological issues happening from overeating consistently. So there has to be some real distress in terms of this is affecting my life day to day. On top of that, 3 of these following criteria must present in order to get a diagnosis of binge eating disorder. Eating more rapidly than normal. So there's just really a ton of eating happening, and they're doing it quickly. And maybe that's part of shame. They want it done and quickly, but usually it's just people who just want to eat. They've lost control and they're just eating. Eating until painfully full. So like I said before, they're just eating until they're uncomfortable or until the food is gone. So whether you're full or not, you're just going to keep eating until it's gone and you're feeling really uncomfortable and painful. Lots of food even when you're not hungry. So you may just start eating, you're not hungry, it's just something that you're going to do. So maybe you just had a meal an hour ago and you're really not hungry, but you start indulging in binge eating episodes anyway. Eating alone, like I said before, a lot of these people feel ashamed about and guilty about their binge eating. So a lot of times they'll take it somewhere else where they don't have to be around people, they're not being judged, and they can eat alone. They also feel very disgusted with themselves, depressed, sad, guilty after the binge is over. So most people after, the food is gone and they've kind of gained that control back, they feel very ashamed of themselves. And they start to get down on themselves about what did I just do? How could I do that again? I'm disgusting. Stuff like that runs through their head. And sometimes this can lead to even more binging if they are thinking, you know what, I'm already, a terrible person. I'm disgusting with myself. I might as well just keep eating. There is no specific food that has to be consumed for this diagnosis. It's not like it has to be junk food. It's really more characterized by the amount of food that's being eaten in one sitting. So whether it's McDonald's or whether it's, rice and chicken, if you're eating a ton of it in a short amount of time, that's all considered binge eating. So there's some prevalence to consider, but in terms of, how do we know how people develop this disorder? There's really not a lot that we know about it at this point. There are a couple of theories going around in terms of childhood experiences, psychology of, self-awareness and all of that. But so far we don't have a lot of information in terms of why people do this. Binge eating is found in both those who are obese and those who are considered normal weight. And by normal weight, I mean just maybe you match the medical index for your height and age in terms of your weight. Though this is those who are obese do have a higher risk of developing this disorder. So something to consider, the fact that people who are obese do have higher instances of developing binge eating disorder. It is also common and associated with those who are in treatment for obesity and being overweight. So those who are actively trying to work on their obesity and being overweight, they tend to develop binge eating disorder as well. It is more prevalent among women than men, just like the other eating disorders that we've seen in the past, like anorexia and bulimia. This one too is more prevalent in men than women. It's also pretty prevalent in adolescents and college-age populations. So something to consider in terms of you're about to diagnose someone and, do they fall within the perfect population that could possibly have binge eating disorder. Binge eating disorder does seem to run in families. So if your parents, siblings, grandparents, cousins, uncles, are binge eaters, you do have a higher chance of becoming getting binge eating disorder yourself. And this may lead to us understanding more about genetic factors that are attributed to binge eating and how that works. So there's a lot more to be done and researched on that for sure. Binge eating is also associated with other psychiatric diagnoses, so some comorbidity here to consider. So there's bipolar disorder, anxiety disorders, and substance abuse disorders. And you can kind of see how these may be connected. So say somebody is having an anxiety disorder and binge eating helps them with that anxiety, or vice versa, and the binge eating disorder is causing their anxiety. Or say people who use substances a lot tend to binge eat when they use substances. Or somebody who's dealing with the highs and lows of bipolar disorder are binge eating at highs, or at lows, and we're seeing that together. So something to consider in terms of, okay, this person has anxiety and they're worried about how they're eating. Is that a link to binge eating disorder? There is a video that I'd like to show you, and this video is really great because it gives us a kind of firsthand look at somebody who is actually dealing with binge eating disorder. I know that we read a lot about the disorders in the DSM-5, and it's all very clinical. But this kind of allows us to put a face to the disorder and what it looks like in real time, how it affects themselves mentally and physically, and their professional lives and their personal lives, as well as the history that may attributed to having binge eating disorder. So this is a really great video to kind of get a firsthand look at all of that. So I hope you enjoyed the video. I hope you enjoyed learning more about binge eating and learned a lot more than you knew before. And we'll just go ahead and have you watch this video. Thank you.